CJR stands for Comprehensive Care for Joint Replacement, and we got involved early on in the process, and it's going on 2 years now. It's been amazing. The initial thought was to save money for the system in terms of Medicare and eventually private insurers, but really it's much bigger than that in terms of we're taking better care of patients. The outcomes are better, our readmission rates are lower, the complications are lower. It's just been a huge benefit to the patient, really. The secondary gain is the financial gain, which was the initial intent, but really now it's turned out to be the best thing for the patient. It's pretty much all about rapid recovery, and we have found out from the programs that started this whole process that the faster the patient gets back to their normal life, the better off they are in terms of reducing complications. So therapy's involved, the hospital's involved, and the real focus is on the patient, the family, and outpatient therapy. So the first year in the program, Baptist Healthcare, Andrews, and our total joint program ended up saving financially a lot of money in terms of the cost of the system, that being Medicare, Medicaid, and in return we got some of that money back as a bonus for doing such a great job. I believe it was an A+/excellent rating for us, the only one in the area. We thought we were doing pretty good. We came into this excited but nervous, and we found out that we were up to par with reducing complications, but we had little things we could change and alter and make better for the patient and better for the system. As I said before, the best part about this is, in the last year of the program, I can think of one readmission, and that's it. For one patient out of my 450 a year, it's pretty amazing. That's exciting.